Welcome back to Coding Doctor. Today, we're going to simplify two very important ICD-10 guidelines that every medical coder must know. Coronary artery disease, also known as CAD, and myocardial infarction, commonly called MI. If you are a new medical coder, don't worry. I will explain everything in simple words with easy examples so you never get confused again. So let's begin. CAD guidelines. Let's start with CAD and angina. In ICD-10, when CAD and angina appear together in the documentation, we have to use a combination code. The medical structure usually looks like this: arteriosclerosis of the coronary artery in a native vessel with angina pectoris. So if the impression says CAD plus angina pectoris, we assign a single combination code as I25.XX. Why? Because the ICD-10 book already includes angina inside the CAD code. This makes coding easier and avoids double coding. Here is a simple rule: CAD plus angina equals combination code. AMI guidelines. Now, let's come to acute myocardial infarction. This is one of the most tested topics for medical coders. Let's learn the ICD-10 breakdown step by step. The basic codes are acute MI I21.9, type 1 MI I21.9, type 2 MI I21.A1, type 3 MI I21.A9, type 4A, 4B, 4C, I21.A9, type 5 MI, I21.A9. But here is an important rule all coders must remember. If the provider does not document the MI type, the default is type 1 MI. Now let's look at the two common types of MI. STEMI, ST elevation MI, I21.3. This is also called transmural MI. NSTEMI, non-ST elevation MI, I21.4. This is also called subendocardial MI or non-transmural MI. We also have location-specific STEMI codes: anterior STEMI, I21.09, inferior STEMI, I21.19, posterior STEMI, I21.29, and one more, anterior NSTEMI, I21.4. Highest severity. This is a fundamental rule in ICD-10 coding. Always code the highest severity, which is STEMI. Let's look at two situations. Example 1. The patient is admitted with NSTEMI but later converts into STEMI. In this scenario, we use code for STEMI. Example 2. The patient is admitted with STEMI and later it changes to NSTEMI. Still, we use code for STEMI. So, 1. Whether it starts as NSTEMI or STEMI, and even if it changes later. 2. If STEMI is involved at any point, always use code for STEMI. Initial MI versus aftercare. This is also another fundamental rule. The I21 category is used for an initial MI for up to 4 weeks. If the patient is still receiving treatment beyond 4 weeks, the coding changes. In this case, we use Z51.89, aftercare, for myocardial infarction. Now, what if the MI is healed completely and no ongoing treatment? Then we use I25.2, old or healed MI. Let's make this easy with examples. Example 1. A patient is admitted today with asthma and has a past medical history that includes MI 10 years ago, which is fully healed. So, in this scenario, we code first for asthma, J45.20, as it is the presenting complaint, and use the second code for old MI as I25.2. Example 2. Patient comes for a checkup, had an anterior MI 15 days ago. This is within 4 weeks, so use I21.09. Example 3. Patient comes for a checkup and a medicine refill. He had an anterior MI 2 months ago. As this is beyond 4 weeks, we use Z51.89, a code for aftercare. Subsequent MI, I-22 category. If a patient has a second MI within 4 weeks of the first one, we must assign 2 codes. 1. Initial MI, I-21. 2. Subsequent MI, I-22. Let's simplify with examples. On June 1st, a patient had an anterior MI, and on June 20th, he had a posterior MI. In this scenario, we code as follows. June 1st, anterior MI, I-21. June 20th, posterior MI, I-22. Let's look at another example. A patient is admitted today with inferior STEMI who had anterior STEMI 15 days ago. So we code inferior STEMI today, I-22.1 as subsequent, and anterior STEMI 15 days ago, I-21.09 as initial. This is because the second MI happened within 4 weeks. So let's summarize. 1. CAD with angina, use the combination code. 2. Undocumented MI type, give default code for type 1. 3. Always choose STEMI when severity changes. 4. Initial MI, use I-21 up to 4 weeks. Aftercare beyond 4 weeks, use Z51.89. 6. Old healed MI, use I-25.2. 7. Second MI within 4 weeks, use 2 codes, I-21 plus I-22. These rules make MI coding clear and consistent. Thank you for watching Coding Doctor. If you found this lesson helpful, make sure to like, share and subscribe for more simplified ICD-10 and medical coding videos. See you in the next class.